Habits you didn't know could cause hemorrhoids. Hemorrhoids, also known as piles, are swollen blood vessels in the rectal area that can cause discomfort, pain, itching, and even bleeding. While factors such as genetics and certain medical conditions contribute to the development of hemorrhoids, there are also everyday habits that you may not realize can increase your risk. Here are some habits you didn't know could cause hemorrhoids. Sitting for long periods, especially on hard surfaces, can put pressure on the rectal area and contribute to the development of hemorrhoids. If your job requires sitting for extended periods, make it a habit to take regular breaks and engage in some light stretching or walking to relieve pressure. Forcing or straining while having a bowel movement can put excessive pressure on the rectal veins and increase the risk of hemorrhoids. To prevent this, ensure you have a high-fiber diet and stay hydrated to maintain soft, bulky stools that are easier to pass. If needed, consider using a stool softener to alleviate straining. Not drinking enough water can lead to constipation, which is a significant risk factor for hemorrhoids. Proper hydration helps keep stools soft and easier to pass, reducing the strain on the rectal area. Make it a habit to drink an adequate amount of water throughout the day to maintain optimal bowel function. Rushing or spending excessive time on the toilet can contribute to hemorrhoids. Straining, sitting for too long, or forcing bowel movements when you don't feel the urge can all increase pressure in the rectal area. Practice good bathroom habits by taking your time, allowing natural bowel movements, and avoiding excessive straining. Engaging in heavy lifting or intense physical activities without proper technique or support can strain the lower abdomen and contribute to the development of hemorrhoids. When lifting heavy objects, remember to use proper form, engage your core muscles, and avoid holding your breath, as these practices can help minimize pressure on the rectal area. Leading a sedentary lifestyle can contribute to constipation and increase the risk of hemorrhoids. Regular exercise helps stimulate bowel movements, improves circulation, and promotes overall digestive health. Incorporate physical activity into your routine, such as brisk walking, jogging, or swimming, to maintain healthy bowel function. While weightlifting can be beneficial for overall fitness, excessive straining or holding your breath during weightlifting exercises can increase intra-abdominal pressure and strain the rectal veins. Practice proper breathing techniques and avoid excessive straining when weightlifting to reduce the risk of hemorrhoids. Relying on laxatives excessively or for prolonged periods can disrupt natural bowel function and lead to dependence. Long-term use of laxatives can weaken the muscles of the rectum and contribute to the development of hemorrhoids. Use laxatives only when necessary and under the guidance of a healthcare professional. A diet lacking in fiber and high in processed foods can contribute to constipation and increase the risk of hemorrhoids. A lack of fiber leads to harder stools that are difficult to pass, increasing the strain on the rectal area. Incorporate plenty of fiber-rich foods into your diet, such as fruits, vegetables, whole grains, and legumes, to promote healthy digestion and prevent hemorrhoids. While constipation is a well-known risk factor, chronic diarrhea can also contribute to the development of hemorrhoids. Frequent loose stools can irritate the rectal area and cause inflammation and swelling of the blood vessels. If you experience chronic diarrhea, it is important to address the underlying causes and seek medical advice to manage it effectively and reduce the risk of hemorrhoids. Alcohol can dehydrate the body and lead to constipation, increasing the likelihood of developing hemorrhoids. Additionally, Excessive alcohol intake can contribute to liver problems, which can result in increased pressure on the rectal veins. It is advisable to drink alcohol in moderation and ensure adequate hydration alongside it. Holding in the urge to have a bowel movement can lead to constipation and increase the risk of hemorrhoids. Ignoring the body's natural signals can disrupt the normal bowel function and make it harder to pass stools. Listen to your body and respond promptly when you feel the urge to defecate. Carrying excess weight, particularly around the abdomen, puts increased pressure on the rectal area and can contribute to hemorrhoids. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce the risk of developing hemorrhoids. It's important to remember that everyone's body is unique, and while these habits can increase the likelihood of hemorrhoids, not everyone will be affected in the same way. However, adopting healthy lifestyle habits can minimize the risk and promote overall digestive health. If you are prone to hemorrhoids or experiencing symptoms, it is advisable to consult a healthcare professional for proper diagnosis and guidance.
They can provide personalized advice on managing and preventing hemorrhoids, as well as recommend appropriate treatments or interventions if needed. By being aware of these habits that can contribute to hemorrhoids, you can take proactive steps to reduce your risk. Incorporate healthy lifestyle practices, maintain proper hydration, follow a fiber-rich diet, and engage in regular physical activity. By doing so, you can promote optimal digestive health and minimize the chances of experiencing the discomfort and inconvenience of hemorrhoids.